Are you worried that you're not having sex enough? Are you worried that everyone else around you is having the best sex of their lives after menopause, after the kids have left the house, and you are just sexless and that something is wrong with you? Well, if you have had these thoughts, you are not alone. It's really common in menopause and through the menopause transition to have low desire or low libido. In this video, I'm going to talk about 3 types of medications you can use to improve your libido and to get your sex life back to where you want it to be. Hi everyone, if you don't already know me, I'm Dr. Heather Hirsch. I'm the Clinical Program Director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where I see patients day in and day out on a consultative basis for menopause and oftentimes low desire. So that's what we're going to be talking about today in this video. If you want to take a deep dive into all things menopause and midlife, please check out my course, which is linked in the description bar below. It's called Everything You Ever Wanted to Know That Your Doctor Never Told You. It's a very intimate, personal conversation with me about everything menopause related, risks and benefits of hormone therapy, non-hormonal medications, and a whole module on sexual health. The first lesson is free, so definitely check it out. I also am the host of my very own podcast, Women's Health by Heather Hirsch, where we talk about all things menopause and midlife, and is a great source of free references and resources for you. And I will also include the link to that in the description bar below. Okay, first things first, when talking about changes in your sexual health after menopause and through the menopause transition, there's 3 big things that can happen. The first is a change in your sexual desire. Desire is just what it sounds like. Thoughts of thinking about or being excited about being sexually active and intimate is what desire is all about, aka your libido. 2 other things that can change after menopause and through the menopause transition is also changes in your arousal or changes or difficulty in reaching climax, which is number 3. In this video, we're talking all about sexual desire. The other thing a lot of women ask me is, what is normal? Am I normal? And I'm here to tell you there is no such thing as normal. There never was, there never will be. You and your partner define what normal is for you. Or if you're single and you're by yourself, you decide what normal is for you. For some couples, it's once a week. For some couples, it's once a month. For some couples, it's once a year. And I don't want you to compare yourself to anyone you see in the movies or even friends, because everyone is different and it should make you feel good about your sexual life no matter what you do. Also, it's important to know that at menopause, lots of things for women change. Not only do we lose our estrogen, but we also lose our testosterone. So we lose our sex hormones, which prime our brain to want to engage in sex. Also, the purpose of the sex drive is to reproduce. So at menopause, your brain is sort of telling you, hey, you really can't reproduce anymore, so that's not really the most important use of your time. You might stop seeking it out like you do food and shelter and water, but your partner, especially if they're a man, doesn't lose their testosterone, never gets pregnant or pushes out children, and so never has that same sort of shift in what's natural for them. Now, the diagnosis of hypoactive sexual desire disorder is really important because it encompasses 2 things. The first is low desire or not thinking about or wanting to engage in sex anymore. And 2, this is bothersome and or distressing to you. So very commonly, patients will come to my office and say, I really love my partner. I'm very attracted to him or her. It's just that instead of having sex, I'd rather go on a hike or cook together or watch a movie. But I feel so bad for him or her. I feel like I'm torturing them. I feel really guilty because I'm not being able to give them something that they want. And this is distressing to me for that reason. Or it's distressing because I miss that part of me. Now that my children are gone, or now that we have retired, we have all this time, and I'm bothered by that lack of that part of my personality that I used to have. So therefore, it's distressing. What's not hypoactive sexual desire disorder is the patient who tells me I could never have sex again, I'm absolutely fine without it, my partner is too, or I don't have a partner and therefore I am good. Therefore, we do not need to treat her. All right, so let's get into what are the 3 medical options that I'm going to talk about today for low desire. The first is called flibanserin, or its brand name is called Addy. This is a once daily oral prescription medication. So you have to get this through your clinician and healthcare provider. It is a medication that is classified as a serotonin agonist antagonist. That means it releases some serotonin and it blocks other forms of serotonin. Now we know that some medications, selective serotonin reuptake inhibitors in particular, that cause you to have too much serotonin can actually dampen your libido. The hormone that actually improves your libido is dopamine. So this medication called flibanserin actually works to target specific serotonin receptors, much more targeted than other medications in the SSRI or SNRI class, commonly known as antidepressants, and releases dopamine, which helps your brain to prime it to think about sex and want to engage in sex more. So Addy or flibanserin is also a prescription medication that I actually get through a mail-in pharmacy in Ohio, because that is actually the best way to get this medication for $20 a month versus hundreds of dollars a month if you are going to get it from your local CVS or Walgreens. Don't even get me started on the cost of women's health medications. It's absolutely something for a whole nother video. Now, flibanserin is FDA approved to treat low libido in premenopausal women, and that's because the studies were only done in premenopausal women, but I often use this in my menopause clinic for women who are postmenopausal, and they have very similar results. Going on to medication number 2, this is called bremelanotide, or its brand name is Vilesi. Vilesi is actually an as-needed injectable medication. So unlike the flibanserin, which is a once daily oral medication, flibanserin comes in a pen that you give yourself a little self-injection of 90 minutes or 1 to 2 hours before date night, is what I say. This is a really nice option if, for example, you don't want to add a new medication to your regimen. You already take an SSRI or another antidepressant and you don't want to add something else that can increase serotonin or dopamine or those neurotransmitters, and you want to use this on an as-needed basis, or you simply just want to lower your medication burden in general. The as-needed injectable is a wonderful option. I find this is also a nice option for women who enjoy having intercourse very infrequently, just because in each pack comes 4 and you probably don't want to use more than 1 or 2 a month. If you are, that's an indication to me that you just might want to go on a more daily medication because you want your frequency to be more consistent. So Vilesi was FDA approved in the end of 2019, and it is a really great option because it is also FDA approved for low desire in premenopausal women. Similarly, I use this very oftentimes for my postmenopausal women as well. It does have one side effect that you should know about, which is nausea. Now that goes against wanting to feel sexy or having sex. So it is important to note this happens in about 30 to 40% of women. Oftentimes it's worse on the first injection and then seems to get a little bit better as you use it. All right. Option number 3 I've talked about before, which is testosterone. Now, I recommend strongly against the use of testosterone pellets, and I'm going to link here a video I did on why not to use pellets. However, testosterone is still an option for women at low physiologic doses. Now, this either needs to be compounded, which is just because testosterone is not FDA approved, or the other way I do this is I use 1/10 of a packet of androgel, a packet that a man might use every day. A woman's going to take that packet and make it last for 10 days. I always check testosterone levels to make sure that they are never too high, because supratherapeutic, aka very high levels of testosterone, are very dangerous. So this was a really quick video. Again, if you guys want a deeper dive on all things sexual health, menopause, please feel free to check out my course, The Complete Guide to Menopause. I've been getting amazing reviews since updating it. It's so helpful for women, especially if you coach other women, if you're in the fitness industry, if you're a medical professional, or if you just want to know everything there is to know about menopause and midlife. Thank you guys for watching. I'm so excited we hit 3,000 subscribers. My attic is being renovated, so soon I'm gonna have a brand new YouTube studio for you. I can't wait for you guys to check it out. Please feel free to leave me comments and video suggestions and the things that you guys would like to see next. I'll see you guys next Friday. Bye everyone.